Simple guide to lipid-lowering medication. When we're talking about lipid lowering, we're generally talking about statins. And the key to their names is that they end in statin. The action is by stopping a key process in the liver producing cholesterol. And as a result, they can reduce the bad cholesterol, which is low-density lipoprotein, by up to 60%. And the effect of that is then to prevent vascular events, such as heart attacks, strokes, and peripheral vascular events. Adverse effects then are predominantly muscle aches and pains, and these are quite common, occurring in about 5 to 10% of patients, and these can range all the way through to quite severe muscle damage and muscle breakdown, but this tends to be quite rare. Let's take it to the next step. So statins inhibit an enzyme called HMG-CoA reductase, and this is the rate-limiting enzyme in cholesterol or LDL synthesis. The benefits really depend on the risk of having vascular disease. So even though the cholesterol can fall anywhere up to 60%, if you're at very low risk of vascular disease, then the overall benefit is relatively small. If, however, you have underlying vascular disease or diabetes or other risk factors, then in fact the absolute benefit is much greater. The other adverse effects of statins include a slight increased risk of developing diabetes and liver function test changes, which don't necessarily lead to chronic liver disease. There are other drugs for lipid lowering. These include medications such as ezetimibe, fenofibrate, gemfibrozil, niacin, and others that you can read yourself. These are only used for specific circumstances and are quite specialized. So 95% of the time when we're talking about lipid lowering, we mean statins.